Alarming statistics show that early onset cancer cases have increased by a staggering 79% in the last 30 years. In the UK, there has been a 22% increase in adults under 50. There are many contributing factors, but what role does the food we eat play when it comes to increasing cancer rates?
Our cancer is increasingly claiming the lives of younger and younger people.
The number of people diagnosed with early onset cancer has risen significantly.
The odds have shortened dramatically to 1 in 2.
But obesity could soon replace smoking as Britain's leading cause of preventable cancer deaths.
Do we know why we're seeing this rise in cases in the under 50s?
What we have noticed over time, and the national statistics back that up, is that we are seeing more cancers in younger women, particularly under the age of 50.
GP Anisha Patel was diagnosed with stage 3 bowel cancer aged 39. She is working with researchers to understand more about the possible reasons behind this huge increase.
My husband had told me about lots of patients over the past 5 years that he had seen that were getting younger and younger and more common with bowel cancer. And so it had been there in my mind, but never did I think it could be me. I don't ever think I felt as isolated or alone as I did, because no one else around me had gone through, thank goodness, what I was going through because I was young. That was probably one of the hardest things for me, was actually experiencing all the different emotions that came with cancer, be that grief, be that the anxiety. I never experienced panic attacks and remember waking up at night not being able to breathe. I think the loss of control for me, it felt really foreign, and I really struggled with that.
When it comes to cancer risk, there's lots of different factors at play, but we know that we are seeing a change in potentially those modifiable risk factors. We know that obesity is one of the single most important things that is affecting the increase in cancer rates in this country and around the world. I think it's something like 1 in 20 cancers are related to obesity now. If we could modify obesity rates, it would improve cardiovascular health, it would improve diabetes, but it would also reduce cancer risk, especially in young people, and that's something that's really important.
Keeping a healthy weight reduces the risk of 13 different types of cancers. But does it make a difference in terms of the type of food we are eating?
We have funded a number of studies that have added more evidence to the links between ultra-processed foods and cancer risk. By substituting 10% of processed foods to minimally processed foods, you have a decreased risk of cancers, 4% for overall cancer, 20% for head and neck cancers, 27% for liver cancer, 12% for colon cancer, and 10% for rectal cancer.
In the UK, 60% of our daily calories come from ultra-processed food, but are the public aware of the implications this may be having on their health?
How much of your diet do you think is processed?
Quite a lot, or like 50-50.
I'm mostly on packaged or processed foods.
It just depends, because you never read the stuff on the back of food packaging, do you?
So I guess 90% of my diet is processed foods.
Is that convenience? Is that price? What does it come down to for you?
Convenience and price as well, because I believe that processed food tends to be cheaper than the fresh ones.
For me, I would say the convenience.
There's so much stuff in our foods, like so much sodium, so much sugar, so much preservatives. So I try to stay away from that. It's just a healthier lifestyle.
You don't know what you're putting into your body. You don't know maybe the after effects. You might know that it might not do anything in the short term, but certainly maybe in the long term.
I also personally feel like that whenever I have a meal that's like a whole day full of processed foods, my energy levels are really low.
Ultra-processed foods contain ingredients that you might not recognise, often long list of ingredients, and they're typically low in fibre, low in protein, and they don't contain many other nutrients that are good for our health. So the implications of why they're bad for us, well, their food matrix has been changed, so they're very soft, and because we overeat them very quickly, often that bypasses our hunger signals. A lot of these foods don't contain fibre. Now fibre, it can act as a prebiotic, so it helps good bacteria to flourish in the gut. Fibre also can feed bacteria in the gut, and that is what then produces the short-chain fatty acids. It can also cause an overgrowth of bad bacteria, so high amounts of sugar, saturated fat and possibly even certain additives like emulsifiers can impact on the diversity of bacteria. They can also impact on the permeability. So this means that particles that you don't want entering your gut, so undigested food, toxins, and even bacteria can enter in and cause inflammation, which obviously underpins a lot of chronic diseases. I think Pringles are probably really a good example of something that couldn't be further away from a potato crisp. And these are designed specifically to make you overeat them. Another group of foods that's really become very popular is plant-based meat alternatives. They do contain a lot of additives, I think occasionally, fine, but better sources of protein when you're following this kind of diet are beans, pulses, and lentils. I think when you're trying to unprocess your life, I think it's really important not to focus so much on the foods that you think should be cutting out and really focusing on how to get more of the good foods into your diet.
Since recovering from cancer, Anisha is determined that her family follow a healthy diet based around whole foods and cooking.
My favourite fruits, kiwi. These are so good for your bowel. They're amazing. They've got great fibre, both insoluble and soluble fibre. We have natural Greek yogurt, no added sugars, really good for the gut microbiome, lots of probiotics in that. Oh, love this. Kimchi. I try to get the children on kimchi. Kimchi is a great, great probiotic. I'm going to let you into my vegetable cupboard now. So, green beans, carrots, so the variety is key. So I'm trying to get 30 things in a day. This is my little Indian tin of tricks that my mum gave me, and in here we've got cloves, we've got turmeric. Now turmeric is a super anti-inflammatory. We have what we call ajwain seeds that have a kind of bitterness to them, and all these count towards your 30 plants a day, making your diet diverse, and your gut microbiome loves all of these things right here.
There is a huge responsibility by the governments to ensure that individuals and communities have the support and the encouragement by having accessible and affordable products that are minimally processed.
But it's the accumulation of all these small changes over time that will have the greatest effect on your health.
But it really is about understanding what a well-balanced, healthy diet means. It can be really difficult to talk to people about the fact that they're obese. It's a tricky conversation, and when you're trying to build a rapport with a patient, you don't want to, upset somebody. Having said that, it's a really important conversation that we need to have. We do talk to people and say, listen, there are things that you can do to reduce your risk of this cancer coming back in the future, and those are losing weight, eating healthily, not smoking and not drinking. But I think the really important healthcare message is before somebody gets cancer or before they develop diabetes, and we need to do more to have those earlier conversations as well.